story, there's confusion over the allocation of funds for the free dialysis initiative introduced by the Kufuor administration. The initiative, led by former NHIA boss Dr. Abuaji Da Costa, assured renal patients enough funds had been secured from the World Bank for dialysis until the end of 2025. It was later rolled out in various public facilities in the country, giving patients 8 free sessions per month. However, current Health Minister Kwabena Kando disputes that the free dialysis policy is still active. According to him, the previous government's initiative had no dedicated funding. He insists only 4 million cedis was allocated, which expired in December 2024.
I was a ranking member on the health committee, so there was no sustainable sources of funding for the dialysis. It never happened. I was a ranking member on the committee, and at the time we even suggested to make provision for dialysis, and they allocated 2 million Ghana cedis. And they had to go and take about additional 2 million from corporate social responsibility. I can tell you, 4 million Ghana cedis cannot take care of dialysis in the whole country. So they need to be a sustainable and a reliable sources of funding. Look, if we decide to put all manner of disease on the National Health Insurance Scheme, it will collapse. You have no idea about how it costs to treat, a heart disease or chronic disease, surgeries and what have you. We can't afford to put all these diseases on the National Health Insurance. That's why there's a need for us to provide this special purpose vehicle, a reliable one, so that if you are confronted with this chronic disease, it will not be the case that because you cannot afford the treatment, you then be nearing your grave.
Well, Health Minister Kwabena Kando also says a special committee has been established to explore innovative funding solutions for patients with non-communicable diseases.
Well, as you all recall, we promised to establish Mama Cares, to take care of chronic diseases in this country. And it was born out of the fact that the mortality with respect to chronic disease are very, very, very high. And therefore, before you be able to operationalize such a fund, you need to go through a lot of processes. The blueprint, the legal framework, the sources of funding, and a whole lot of processes you have to go through. So we needed to get a task force in place to present that particular roadmap. A lot of people are sharing their ideas on how this particular fantastic initiative should be operationalized, but we should be able to consolidate all. So they are going to be at the center of affairs to coordinate, to give everybody who is willing to express or to do an input into this particular initiative, so that are consolidating everything, we see it, we think through it, and then it becomes a workable document.
Well, in a recent statement in Parliament, former chair of the Health Committee, Nana Ayew Efriye, opposed the decision by the Health Minister Kwabena Kando, insisting there are already funds to cater to kidney patients.
Now, Mr. Speaker, I go back to the item 1 on their manifesto, which is establishing the Ghana Medical Care Trust Fund to support the cost of care for persons with chronic diseases such as kidney failure, into bracket dialysis, cancers, and heart diseases. Mr. Speaker, do we need to establish a medical trust fund to look at these diseases, or a medical trust fund to raise funds to support Medicare in terms of health financing? Mr. Speaker, listening to the President, his emphasis was non-communicable diseases. Mr. Speaker, may I say and put on record that the vote on account, or the expenditure in advance of appropriation that was done in this House, took care a budget of 57 million that will take care of all dialysis patients in this country. Now, the estimated cost of care was between 20 to 57, but the minister provided an upper ceiling, and that was because the pricing unit of NHIA has made recommendations in September, and it was approved by the board. And so if you are going to establish a trust to be able to finance dialysis, which has been provided for already, I stand to say that this is an error, and this resetting is dangerous and cannot be tolerated and cannot be done. Mr. Speaker.
Well, let's have this conversation with Kojo Bafo-Ahinkra, President of the Renal Patients Association. Also joining us is Labram Musa, is the National Coordinator for Ghana Non-Communicable Diseases Alliance. Let's start with Mr. Ahinkra. You've heard what's happening now. The Health Minister says that the monies for your dialysis ended 2024. We've entered 2025. Have you heard this? Now, the Health Minister says that the monies for your dialysis. Could you reposition yourself and then come in? Mr. Bafo-Ahinkra is the President of the Renal Patients Association, and he's joining us in this conversation on Zoom, but apparently. So we'll be touching base with him shortly on him. All right, Mr. Ahinkra, I understand you're on phone with us. Could you tell us, please, this is what's happening now. What's your reaction to this?
Yeah, thank you very much. I'm a bit surprised, but the point, I'm not in that. I don't know whether that's what it comes. Because the minister is that it ended somewhere. As I speak to you now, I have some of the patients are the money. And if not them to pay any money, I don't think there was any argument the minister because he was that for the 3 months it has paid. That is started from
Mr. Ahinkra, I seem to be losing you. Could you reposition yourself so we can hear you clearly?
Okay, all right. Is it okay now?
Much better, thank you.
All right. So like I was saying, last year during the last administration, we were made to understand the first 3 months have been paid, and then a month put it the food the year 2025. So we hear that it ended 2024 was a bit surprising because last Monday I dialyzed and I was not asked to pay any money. So I don't know if it's now going to end or not. I don't even know how it's going to be.
Well, have you heard from the hospitals telling you anything of this development?
Please no. I mean, Kolebuna still have not heard anything. We are having today's World Kidney Day, and we are having a program, and the patients are doing their normal sessions, and we've not been told anything yet.
Well, thankfully you've not heard anything, but in the absence of a clear, sustained funding, what emergency measures would you put in place or implement to ensure that you continue receiving, your dialysis for free?
Honestly speaking, we've been trying to meet the minister for the past 3 weeks because we were suspecting some of these things coming. But we've tried, we've not gotten him. As we speak now, we don't have anything in place because the then administration made us understood that they're putting some money into the vote to cover the year 2025. So we don't have any plan for anything. All that we knew that once we have our national health insurance card, we can dialyze. So as we speak now, we don't have anything in place. The only thing we can do is that engage the minister and let the way forward. And we've tried several times. We've not been able to get it. We've not got the answer to it.
So you've not been able to get through to the minister to at least communicate the next point of action?
No. The last time, one of his PA that we've been communicated with, so that he has got, the PA had an accident and he's not in Accra. There was a time, he gave us time and date. We went to the ministry, we sat there for some time. We were told that we cannot meet the minister and we have to come back. For the past 3 weeks, we've been trying all means to get him to sit down with him and then we'll see the way forward. We've not gotten it. So we don't even know what is going on. But what I would think they should put in mind that now the mortality rate is very low. Hardly do you hear a kidney patient is dead or something. But if this thing is to happen right now, they should expect the mortality rate rising up because the patients are all youth between 18 to 40. None of them, most of us are not working. They are students. We have a 13-year-old girl who's on dialysis. We have 9 years old who's on dialysis. Where are they going to find the money? The parents are already poor. So you can just imagine. Rather, I think if the previous administration did not do something right, they should correct it, and then let's move forward. We need to move forward from some of these things.
Right. Well, there's a timeline. 2025, your funds expire. What then do you do from there?
Like I'm saying, we are now trying to put ourselves together. We need to be the minister, and then we'll put our request before them because it's capital intensive. We cannot be the individuals. We can't pay. We can't pay. Yesterday, I learned the Mahama Care was launched. Very good initiative. It will help us. We really appreciate that thing. But we were not involved. A committee has set up without we, the beneficiaries, being part of it. We don't even know. We wish they could have involved us because we are the affected people. We know what is wrong with us. We can tell them what we need to do. You see, but we've not get. But like I said, the minister, when they were in opposition, I remember he was fighting for us. He was really, really fighting for us. Sometimes on radio, we hear him. So we beg them. Let's really look at this whole thing very well. And it's saving human life. This sickness, it can happen to anybody. We have doctors among us. We have MPs among us. We have doctors among us. Everybody is part of us. So we beg them. They should look at it for us. We are just begging. If this thing is trapped, we don't know what is going to happen. Even the thinking alone can even kill some of the patients.
Well, let me bring in Labram Musa, National Coordinator for the Ghana Non-Communicable Diseases Alliance. Labram, and today, incidentally or fortunately, I don't know how to explain this, happens to be World Kidney Day and also part of the non-communicable diseases. You're hearing the conversation that's ongoing now. What's your reaction to this?
Right, so thank you very much, and greetings to your viewers and listeners, and greetings to my other colleague on the other side. Myself, I was taken a bit aback on the development, especially hearing from the minister. In fact, and of course, I mean, being an advocate and also working on non-communicable disease for at least over a decade now, we have been, advocating, speaking, I mean, to ensure that the people living with non-communicable diseases, are given, some kind of treatment or preferential treatment when it comes to matters of, treatment and then care. Because just as we all know, currently the death toll in Ghana, as far as NCDs are concerned, is running around over 90,000 people dying from non-communicable diseases, representing, over 43% of all death in the country. The leading cause of death, of course, but of course, I always say most of them are also preventable. So, and there's that kind of clarion call, globally to ensure that every country is doing everything possible to meet the Sustainable Development Goals, which ends in 2030. But more specifically, there's something we call the UAC, Universal Health Coverage, and we are told by the UN and then also the World Health Organization that almost every world is off track in achieving the UAC. When I say UAC, what I meant to say is that how do we ensure that we are able to take people out of, abject poverty by ensuring that at least the care and the support and hospital bills that they need at the point of need is available for them. Now, so having established this, indeed, you would then know that indeed non-communicable diseases is killing, is maiming, is destroying. So we need to have intervention to ensure that we're able to reduce the extent of damage and the extent of death and mortality in Ghana. Now, so we were very happy when the previous administration introduced the dialysis, the free dialysis. Indeed, it started with a pilot. Hello? Indeed,
it did. Go ahead.
Yeah, it started with a pilot, which we were all happy about. And then I think by December 1st or so, we were told that it's good that they're going to free dialysis for anybody who is suffering from, dialysis. And we all heard in this country from last 2 years, the the difficulties, the hospitals were having in treating, people with, renal problems, kidney problems. And this was as a result of, lack of funds, and people were unable to pay for, the cost of treatment. So it came as a kind of relief to many of us. In fact, even at the global level, people were actually commending the government for this bold initiative of ensuring that people who were suffering, and the fact that the mortality was also very high, were happy, because then, especially, you also know that at a point, the hospitals were shut down. The Conference and then especially was also shut down because of funding problems, and then also equipment problems, and patients were now going to private hospitals, and they were not able to also pay, the cost of treatment. And you heard from the other gentleman that people at the very lower age are now contracting these diseases. The parents don't have it. Many Ghanaians do not have, the funding to take off, the loved ones. And one of the the disease that is actually coming up recently is renal problems, kidney problems.
So Mr. Lampa to come in here, and not to cut you, but you heard from the health minister that there have been measures put in place to support patients with NCDs. Have they reached out to you? What are the modalities that have been put in place in that regard?
Well, so they've not reached out to us. What I'll say that probably it's early days yet, because the president announced it in the SONA that is going to establish a mama care. We're happy, we commended, the effort. And we heard that there's going to be a launching of, a steering committee or something. It has not come to our attention, but I want to believe that indeed they will do the right thing by ensuring that stakeholders who matter in this regard are actually involved in this, especially patients who are living with this condition and who bear the brunt. They will be able to talk, how within that we can effectively, ensure that these initiatives that started last, by the people admission will not die off. It will continue to save life, and make many Ghanaians happy, as we move along, in the health sector.
Right.
And indeed, it's also going to put the Ghana, at the global level as, one of the countries that actually takes care of its people when they are sick.
Well, you are an advocate that non-communicable diseases should be kept being the highest cause of deaths in the country. What will be the, real issues that the government should tackle? Aside funding, what should be the things, the policies that must be put in place briefly that government has to immediately, take on?
Right. So just as I mentioned, we have commended government on the initiative, but we are still looking at, we are still in this way of doing things which is not the best. I'm talking about the firefighting approach of doing things. We need to also look at the root cause of these issues. That is why, if you look at the, the fact that we are celebrating World Kidney Day, there's a clarion call for people to do a lot of things by themselves. Sometimes you must own your own health, and that's very critical. So, for instance, people must regularly check their kidney. Sugar is one of the major risk factors, for kidney problems. Alcohol intake, smoking. These things affect our kidneys, and I want to tell people that you don't know what's within you, so be very mindful of what you consume on daily basis. Check check and be sure that these things are are wholesome consumption. They are things that when you consume, it does not have effect on your body. But more especially, I would say that government should look at the health promotional measures like education, awareness creation on things that would increase this situation. That is why we're also happy, on the fact that the previous administration also, levied or put taxes on sugar-sweetened beverages, just so they become a bit expensive for people who will not be able to afford. Because the more you are consuming these sugar-sweetened beverages and on health commodities, the more it impacts on your kidney, and the more you have renal problems. And I'm not surprised. Especially because we are seeing more of the youth and young people, getting involved in or contracting non-communicable disease like the kidney problems. And the results are there. When you go to hospitals, you see a lot of kids there, a lot of young people who are on dialysis. So we need to change the way we do our things. The establishment of the fund is good, But let's look at, how do we tackle the root cause? Let's levy more taxes on unhealthy commodities,
right,
so that people will not be encouraged to buy these products, so that eventually we're able to reduce the scourge and the extent to which people are suffering from non-communicable disease, more especially dialysis in that part of the world. And I'm saying part of the world because Africa is mostly, overburdened with many diseases.
All right. Thank you, Mr. Labram Musa. Well, thankfully, we're joined on the line by Dr. Nsiasare, former presidential advisor on health, to, give us more information about this funding for kidney dialysis. Dr. Nsiasare, we're grateful for your time on News Desk. We heard today that the current, health minister, Dr. Minta Kando, Mr. Minta Kando is saying that your administration allocated just 4 million cedis to kidney dialysis, which ended last December. Please, can you educate us? What really went down there?
Yeah, thank you very much. I will just try to set the record straight. Maybe the best person you should have called is the CEO, the former CEO of health insurance. But I know about this because I chaired a committee which the health insurance set up on dialysis. When the issue came, there was a whole hullabaloo about dialysis. And I'll give you the facts straight. We met, the committee met, and we decided that we would do a pilot, if you remember.
Yes.
So a pilot was from June. We did a pilot till November 30th. And the technical working committee then recommended an addition of dialysis permanently on the benefit package from 1st December 2024. And the additions onto the benefit package in health insurance is a technical issue done by professionals. So the implementation of the permanent dialysis on benefit package started smoothly. And after the recommendation of the technical team, an amount of 20 to 57 million cedis were needed annually for the dialysis of patients of chronic renal failure who are on dialysis of about 1,200 to 15,500. So the finance minister, after the initial investment of 2 million allocated by Parliament with the National Health Insurance Authority, added 2.4 million from the corporate social responsibility budget. And that means 4.4, which was used for the pilot phase. And since it was a priority to the then government, an amount of 57 million out of 1.9 billion first quarter 2025 budget was allocated on the vote of account by the former finance minister, which was approved by Cabinet, which the Honorable Minister sits on in January 2025. You should go and look at the records. So the vote on account budget for national health insurance was 1.9 billion for the first quarter of 2025. And it included, as I will tell you, free dialysis. If you like, you should call the president of the Dialysis Patient Association and you confirm that nobody is paying for dialysis since even January to date. And if you remember, 20 facilities were published by the National Health Insurance Authority in December 2024 to assess patients who have this dialysis. These services are currently ongoing smoothly at the various selected facilities throughout the country and has been confirmed severally by the president of the Dialysis Association. As I say, 45 dialysis machines were also donated to collaborate to support the free dialysis program. So if he's saying that, I'm a bit surprised. Nobody, that there is a funding, even if all the 6,500 patients are coming on board on 2025, which will cost about 57 million. It is part of the $1.9 billion. So if he says that, I don't agree with him. And I want to quickly remind anybody that benefit package is a technical decision and not a political decision. That's the reason why the technical committee of the benefit package accepted that let's add dialysis to the benefit package of the health insurance. And they gave us quotation for 1,200 to 1,500 patients. and if all the 1,500 patients are on it, because we know as the free dialysis continues, a lot of patients will come on board. That's the reason why we say that the 57 million is even catered for in the first quarter of the 1.9 billion Ghana cedis, which health insurance had from the allocation that the former Minister of Health read in Parliament and approved by Parliament in January 2025. So I would wish that he goes back to check the records so that I'm just setting the records straight. In my capacity as the chair of the committee we start on free dialysis for the failure patients.
Indeed, but Dr. Nsiasare, was this information made or handed over as part of the handover notes given to the ministries, the health ministry?
Yes, I'm sure if you ask the former chief executive of National Health Insurance Authority, he can confirm that. But is it not even handed over? It was read in Parliament. I got the first quarter parliamentary allocation, which was read and passed by Parliament, accepted by Parliament, by the former minister. And it's a member of Parliament, so you should even know that that's what it says not true. If you like, it's not confirmed from the Minister of Finance, and they will confirm the same to you. So as the teacher, this is what I know.
Right.
We can't do the proper process after the pilot, which ended on November 30th, that we are going to add a free dialysis to the list. So if he says that it is not there, I'm surprised.
Well,
but this is the true record I'm telling you. And you can confirm from the National Health Insurance Authority, either from the former chief executive, or maybe I'm sure all the records are there, so that the current chief executive can also confirm it.
Well, there's a timeline of it being completed in 2025. Were there plans to extend this, or it was going to end in 2025 and that was it?
No, once something on the benefit package, there's nothing like extension. For example, we added in I think 2021 or 2022 added family planning, so it's permanent on it. We've added exception for sickle cell patients, it's permanent on it. We added the 4 common childhood cancers in the country, it's added on it. And then I think in December or so, we added also the 4 common disorders in mental health patients. They are all part of it. And we also added 1 free medical check for anybody who is a card-bearing member, active card-bearing member of health insurance. These are all part of the benefit package, like about 85% or 90% of the disease burden, which is part of the benefit package. Benefit package, we don't go back and go and renew it. That's not the case. So you budget for it. When you are budgeting for the health insurance, it is part of the package. It will interest you to know that health insurance clears all the standing bills. You know, what is happening is that you normally have what we call a 3-month window period for you to submit and claim your money. After the 31st of December, they were within the 3-month package. And for the first time, last year, health insurance had almost about 99 or so percent of their budget allocation of about 6 Ghana cedis. That hasn't happened before. That's when the we are living power left maybe a 6 months or 1 year backlog of reimbursement. It hasn't happened. Health insurance started operating in 2005. So I will repeat, once something is added on the benefit package, you don't have to renew it. You have to budget for it.
All right. Well, for this one, the 57 million cedis, where is it coming from? Was it government, or I also understand some of the funds were gotten from the World Bank. Was this the case?
So how do you budget for health insurance? Health insurance money is mainly from National Health Insurance.
I'm talking about the kidney dialysis.
Yes, that's what I'm saying. That for the free kidney dialysis for from 1st December throughout the whole of this year have been budgeted for in Ghana government budget.
Right.
The first pilot, I've told you where it came from. It came from the corporate social responsibility money that the health insurance have, and also from allocation of money from the Ministry of Finance, not from World Bank.
Right. So the money is there.
Who will give that information wrong?
Okay. Okay.
So please, let's give out the proper information, and you can cross-check from National Health Insurance. The same thing I've been hearing that the minister is still insisting that there was no allocation for Agenda 111. Their own budget. If you look at the oil revenue allocation, you will see ABFP of 20% CAPEX to give for Agenda 111. I've forgotten the page. I will have you go through the budget. I'll get the page and quote it for you. It is written there. And every year since 2022, there's always money from the oil revenue and also direct budgetary allocation, which is allocated for the construction of Agenda 111. So if anybody says anything otherwise, I find it very difficult to accept. And that's what I've been saying. If anything which is good in this country, especially so far as everything, if anybody wants to just demodernize it and throw it away, who will come and set the record straight?
Right, Dr. Anthony Siasari, thank you so much for that
clarification. If you have a minute for me, I will tell you the allocation.
Please go ahead. Please go ahead.
Since we started, for example, for annual budgetary allocation, the ABF equipment in 2021, it was 351,914.186, which the actual receipt was 252,697,552. In 2020, government allocated from the ABFA CAPEX 441,752,892 cities. But we actually received more than that. We received 690,833,880. So we had even a positive variance of 249 million. In 2023, 788,937,081 cities was also allocated in the budget, and we received 681,407,023 cities. Last year, the government allocated 1.125 billion Ghana cedis from the APF, and we received 1.126 billion 150,000. So we had also a positive balance. So far, since 2021, government has allocated 2.717 million, 2,770 million. That's 2.71 billion, and we received 2.701 billion from ABF. If you go to the yearly direct budgetary allocation, in 2020, if you remember, out of the COVID fund, government gave 100 million, which was then 600 million, which we started giving to the contractors to start. That is, we gave them some mobilization. And in 2021, government gave us 1.081 billion from direct budgetary allocation. 2022, 464 million. In 2023, 788 million.
Right.
In 2024, government gave us 1.812 million billion Ghana.
Right.
So far, we received direct allocation for budget was 4.748 billion, which we received 4.294 billion. So government has done extremely well that every year they allocate. So there's a source, and there are two sources of allocation during the budgetary allocation to Agenda 111. One, 20% capex from the oil revenue, EDFA, and also direct budgetary allocation from the government budget.
Right.
The government thought that it is one of the most important legacy and heritage projects that you should give to Ghana. And to me, health is a basic need, and not only basic need, but health is also what you call it. If you give good health to the people are well. For instance, that health is wealth, and there's also wealth in health. So health is not just an ordinary cost to anybody. It's incumbent on every government to provide good health care to the people of this country.
Right.
And it's one of the most important, to me, responsibility of any government. So that's how. So health is an investment. It's not a cost.
Okay.
And I'm hoping, I've looked through the budget. I'm hoping to see where they have allocated money for Agenda 111. And I thought that it should have been in the budget. Like you mentioned, free SHS and other things. It's very, very important.
Yeah.
Because if people are not well, they cannot even go to a secondary school or university. Or you will not be sitting there asking a question. Now, not. So
Indeed.
I have, for many years, I believe that the first thing, even COVID showed us all this thing, that if for nothing at all, you should be healthy before you move forward.
Right. Right.
And I'm happy that as a response, a direct response to what we saw during the COVID period, Agenda 111 became a very important initiative of His Excellency, former President Ado. And we all live here to see.
Okay.
If people will start falling, why have we not continued Agenda 111? From what I've seen, that may be what is happening. But I can assure you that we are all in the country and will continue to set any record which anybody says which is not correct. Right. We set the records very straight so far as health is concerned. Thank you.
Thank you so much, Dr. Anthony Nsiah-Sarrey, former presidential advisor on health. And just to wrap up this conversation, Mr. Labra Musa, your concluding statements on what the former presidential advisor has said.
Right. So I think he has given us, some good information, and for some of us, we are very much aware of some of these information. And what I would say is that we need to come together as one. As Ghanaians in the health sector, so that at least we can continue to provide the needed care, the needed support for people who are suffering from chronic conditions in the country. So I would urge my very good friend, the Honourable Minister, to bring all of us on board. I believe that everybody wants to ensure that at least people in Ghana, people who are suffering from conditions like the renal and dialysis, we would be happy if we all come together to find a lasting solution. The point is that, yes, indeed, money has been allocated. Money definitely, once allocated, will finish. How do we ensure that we continuously allocate money, to ensure that we are able to reduce the burden? So with the Mahama Care Fund, we are also hoping that at least once, they unpack, how it's going to work, we hope that at least all the key stakeholders will come on board to support this initiative. Because like I said, at the end of it all, it's Ghana that we are all aiming to ensure that we develop. And the health sector is one of the critical aspects of our nation development, and we can't let that go.
Right. Thank you so much, Mr. Labra Musa, is National Coordinator for the Ghana Non-Communicable Diseases Alliance. Mr.